So a 44-year-old firefighter came to us, exhausted, gaining weight, brain fog, no drive. He'd already been to his doctor. You won't believe what they told him.
His testosterone was 180. For a man his age, that should really be between 700 and 900. But here's the thing, low testosterone doesn't just make you feel tired. It affects everything, every tissue in the body. Today, we're walking you through the 7 signs of low testosterone. If you've got 3 or more, you need to hear this.
So we're going to show you what causes it, how we find it when other doctors miss it, how we treat it, and the one sign that gets overlooked almost every time, even by your doctor.
I'm Chris, nurse practitioner here at Elite Medical.
And I'm Eldon, nurse practitioner at Elite Medical.
And I'm Dr. Don Vovell with Elite Medical.
So sign number 1 that you may have low testosterone, crushing fatigue. You're not just tired, you're exhausted. You sleep 8 hours, you get up, you're still tired, you can't get off the couch.
Another sign of low testosterone is losing muscle, gaining fat, especially belly fat. Working out and nothing changes. So even after working out, you don't feel like you're gaining that muscle and you're still putting on the adipose tissue.
Like you, Eldon.
Much like me.
Yeah,
correct.
exactly.
100%.
So sign number 3, you're losing strength and endurance. You can't finish those workouts. Recovery takes forever.
Those are the physical signs, but here's what most people don't understand. It's not just age doing this to you.
So age is an important factor in low testosterone. Your testosterone usually drops after the age of 30, about 1 to 2% per year. But it can also be caused by stress, poor sleep, obesity. Certain medications can cause it, as well as environmental toxins.
So our firefighter was working 24-hour shifts, 24-hour shifts on, 48 hours off. His cortisol was through the roof, never getting deep sleep at the station, and his body just couldn't keep up.
And it's not just older guys. We had a patient in his 30s, former bodybuilder, testosterone was 80, damaged his own production after high uses of illegal steroids over the black market. We got him back up to about 900.
So you've got the physical signs. You know what causes it, but what low testosterone does to your mind, that's what catches men off guard.
So sign number 4 is brain fog. You can't concentrate, you can't focus, and you feel like you're in a haze all day long.
Sign number 5, low motivation, decreased enjoyment of life. Things you used to love don't matter anymore.
So remember, if you have 3 of these symptoms, that is a sign of low testosterone. And our firefighter, he had 7 of these symptoms.
So he's sitting in our office with 7 symptoms. But here's the problem. His last doctor only ran 1 test.
1 blood test. That's all they ran. He went to his doctor with these symptoms, they ran 1 blood test, called it normal, sent him home. But normal doesn't mean optimal. We check total T, free T, estradiol, FSH, LH, comprehensive metabolic panel, because normal isn't optimized. Come see us at EliteMedicalOcala.com.
Not just one number, total testosterone, free testosterone, sexual hormone binding globulin, estradiol, luteinizing hormone, follicular stimulating hormone, a full metabolic panel.
His total T was 180. Luteinizing hormone and follicular stimulating hormone were normal. His body was trying to produce it. It just couldn't get there.
So the lab normal range is 264 to 916. We target 700 to 900 because a man at 300 feels terrible. We optimize for how you feel.
So now, you know how we find it, but there's one sign most men won't even talk about.
Sign number 6, and this is important, low libido, weaker erections, loss of desire. It's not in your head, it's in your labs.
So you've got the signs, you know what's going on. Now here's what we actually do about it and how fast it works.
For your low testosterone, we do have to do a few things. First, we're gonna check an EKG, prostate-specific antigen, get your vital signs like your blood pressure, heart rate, temperature, and we will check everything before your start. We will monitor your labs every 6 to 8 weeks, and then once stabilized, we will then monitor every 3 to 6 months.
With our firefighter, about 6 weeks in, his brain fog lifted first. That was the first thing he saw. Energy came back, motivation returned. We targeted about 700 to 900. We got him there. 2 to 3 years later, he feels amazing.
The brain fog was the first thing to clear up. It took a little bit longer for the libido and the energy, but the brain fog cleared first. He said he felt sharp again. He felt like he was in his 20s. That's what optimized testosterone does. It gives you your mind back first. So come see us at EliteMedicalOcala.com.
So we've covered the 6 signs, but remember, in the beginning, we said there's one sign that your doctor misses.
So sign 7, depression, the most misdiagnosed symptom of low testosterone.
So, low testosterone makes you depressed. Your doctor then prescribes antidepressants. Antidepressants cause weight gain, which also leads to low testosterone. And on top of that, it leads to worse sexual dysfunction.
So now, because of this, you're more stressed, you're more depressed, you've gained more weight, you have less drive, you're on more medication, and nobody even checked your testosterone.
So do you remember our firefighter? We didn't just treat the symptoms. We found the cause and we fixed it.
Low testosterone causes depression, but your doctor prescribes an antidepressant. Your antidepressant might be making you worse. Antidepressants cause weight gain and sexual dysfunction. Now you're more depressed than before, and no one ever checked your testosterone. That's the wrong diagnosis. Come check us out at EliteMedicalOcala.com. So what do you do about it? If you're sitting there now, counting the signs you recognize, here's what comes next.
Free consultation, no commitment. We'll get a symptom questionnaire and we'll get a full history from you. At that point, if you'd like to continue, we'll get a full set of comprehensive lab work and we pair your symptoms with your labs.
So we don't treat a number, we treat you. If you feel great at 500, we stay there. If you need to get to 800, we will get you there. We focus on optimization, not performance enhancement.
So back to our firefighter, he's 2 to 3 years in, loves his life, feels amazing. His words, I should have done this a long time ago.
So if these signs sound familiar and if you recognize yourself in 3 or more of those, don't ignore it. Don't push through it and don't let someone treat the symptom without finding the cause.
So come see us today for a free consultation. Visit EliteMedicalOcala.com. Or you can call us or text us at 352-441-9775. We will check everything your doctor probably did.
And ladies, this isn't just a men's issue. In our next video, we're talking about hormone replacement for women, perimenopause, menopause, and beyond. You don't want to miss it. Thanks for watching. Feel elite.
Be elite.
Elite Medical Ocala.